Welcome back to the part 2 of surviving a traumatic experience in Nigeria. Let me put it that way. Hi guys, welcome to my channel. Gosh, I love the sound of welcome to my channel. Well, my name is the Fitness Farmer and this is a continuation and possibly the last post on this surgery series of how I survived intestinal obstruction caused by adhesions after the surgery. Normally, as expected of every surgery, after 2 or 3 days, you're supposed to pass gas, and this is an indication of successful surgery and that the patient is ready to start her healing. But in my case, the first day passed, second day passed, third day passed, fourth day passed, I didn't pass gas. Instead, I was swelling. I was still filled up with liquid, I don't know, like fluid. Instead, I looked swollen. I still had tubes used to decongest my already swollen small intestine, so I was still suffering from, I couldn't breathe well because the tubes were passed from my nose to my tummy. It was still leaking out. This is after the surgery, and I couldn't pass gas for some funny reason, and this would show that, okay, my bowels are now set right, and the surgery was a success. And because of that, I couldn't eat or take any liquid or water for 10 days. For 10 days, my organs found it hard to adjust, had only drips, antibiotics, and so many injections sustaining me. The reason for the drips was that, of course, for somebody to go without food or water for close to 2 weeks, you need drips to keep you hydrated. And the drips also acted as food for me because of the amount of antibiotics I was being given, pain relieving meds, my BP shot up. So the worry of the doctor was, why hasn't she passed gas? I couldn't see with one eye, and I heard it was part of the side effect of the high pain meds they were giving me, or a side effect of one of the antibiotics they were giving me. I couldn't have to press one eye to open this other eye to see. So I was going through so much. I couldn't talk or breathe well because they had to decompress my stomach even after the surgery. So it was until the green stopped flowing on the 8th or the 9th day, and that was the day they removed the tubes from me. I was with that tubes for close to 2 weeks, being drained in the hospital for close to 2 weeks. It's an uncomfortable feeling. My throat was raw. I couldn't talk. Another horrible experience that I went through was them having to pass that pipe through my nose and force it down my tummy. It was one of the most horrific traumas that I've ever passed through, because it feels like you're choking and you're struggling to breathe at the same time. And having to have that inside me for close to 2 weeks is another experience I cannot even say here. In that 10 days, when I couldn't pass gas, I was scared. I was saying to myself, what is wrong with me? Other people pass gas within 3 to 4 days. And doctors will start being worried a bit that why is she not passing gas on the 5th day, on the 6th day. I wasn't eating, I was not drinking, I was on drip, I was worried, I thought I would die, because passing gas shows the success of a surgery. And my hands were swollen because at least, I don't want to exaggerate, but I took at least 35 drips. Those drips had serious antibiotics. In fact, I stopped counting at a point because they couldn't get the drip off me, because it was the drips, the saline, the antibiotics, and of course, it was sustaining me as food. Could this have been prevented? Yes. And this is my point. With some Nigerian doctors should do better. Doctors in Nigeria, please do better. Educate women that after surgery, if you're feeling this kind of way or this kind of pain, and please bear it in mind that this pain can come 6 years after surgery, 8 years after, so even 6 months after surgery, 3 months after surgery. Not to all women, like I said. If I was educated or properly diagnosed, it wouldn't have gotten to this extent where my intestines would be completely blocked and I'll have to go for surgery. So the point of this video is to educate other women, other people that have gone through surgeries. Fibroid, CS surgery, hernia, abortion, appendicitis. Adhesions might appear after any of these surgeries and more. Now, this is where it gets interesting. When I was lying on the bed, I kept on asking myself, why me? Why didn't I know about this? I'm somebody that I love to read, I love to be knowledgeable. Of course, I know about myomectomies, fibroid surgeries, I know about adhesions, but why didn't I know? Or why did they not educate me that for some women, these adhesions might cause pain? For some women, these adhesions can lead to complications. For some women, these adhesions might, gum to some parts of their organs, not only the intestine too. It can gum to your ovary, it can gum to anywhere. Why wasn't I educated? Doctors should do better to educate people so that we are aware. Knowledge is power. So I started the research. What can be done so that it should not repeat itself again? Of course, I asked the doctors, is there any reassurance that you will give me that this would not repeat itself again? And they didn't have anything to say. They don't know. So I started researching. Is it only me? Does it happen to other women? And in the course of my research, I found out that it happens to many women. A lot of women, you can see a lot of women, I had to go on social media, I had to type adhesion and scars, I had to read up about what was going on with me, and I saw that this was not peculiar. I was not a peculiar case. It happens to lots of women all over the world. I started reading comments. You can see the comment by this lady here. You can see the comment by this lady here. Her laparoscopy, she was told that she had adhesions. She was in constant pain. She was in constant pain and still had the worst periods ever. And let's say this one. I saw another one. She said today will be her third surgery to remove adhesions. My eyes opened. That for what she can see on her scans, her adhesions were stuck to her ovaries. So many comments. Doctors are supposed to be educating people who have done surgeries. What can you do to manage your scars? What can you do to manage your adhesions so that it won't happen again? And this is what I found out. 90% of women have adhesions after a surgery. Now, for those people, what can you do to manage those adhesions to make sure that they do not heal together with your organs? They did not cause you pain. They did not cause you complications like me. These are the kind of answers doctors in Nigeria should educate women and men, because even men to have adhesions after a surgery. How can you manage your adhesions so that you do not get to the point where you have to have surgery or your adhesions have started causing you pain inside you? First, dietary change. You take lots of probiotics. They have what they call probiotic therapy. This is where you change your diet, you take lots of probiotics. Probiotics can help clear gut infections. A study in 2020 showed that probiotics help to reduce surgical adhesions. Lifestyle changes can decrease your risk of adhesions. Lifestyle changes like exercising, walking. The last one I want to focus on, and this is what I do, is the massage therapy. Everything I have called out here is the natural way to go. Some people that already have these pains and they don't necessarily need surgery, they live with these pains, they manage their pains. You can research, read about it. How can I manage adhesions after a surgery? The natural way. They have lots and lots of research on it. Women have talked about it, on what they did to prevent this. This therapy focuses on using gentle techniques to break up the adhesions inside your tummy. It is like giving yourself a mild massage all around your point where you had your surgery. This helps to break up any form of adhesion or scarring clinging to your organs. Out of Nigeria, they have massage therapists that actually specializes on massaging patients after a surgery. But you can do it yourself. If you go on YouTube, castor oil is a very potent oil. It is one of the few oils that seeps directly into the skin. So you pour a little on your hand if you don't have a heating pad, and you use it to massage your scar, massage all the places around your sites for a few minutes before you start your day. Please go and research and see how they massage all around your surgical sites to break up any form of adhesion. I don't want to talk about the pains of after surgery, but I just want to thank God for my life. I'm just thankful that I passed that stage, and even if I was late in hitting my milestones, at the end of 2 weeks, I could leave the hospital. I stopped draining fluids. My small intestines went back to size. I passed gas, and then began my journey of trying to walk, trying to bear the pains, trying to sit up, trying to do better.